Hi, this is Dr. Lori Bagai from Smart Smile Dental in Orange, California. We get a lot of questions about dental implants, so I'm going to answer the questions in dental implants today. Dental implants are basically robotic teeth that are started from scratch for you. So you don't have a root, you don't have a crown, and everything is made with metal. And we put the root in first, then we put a connector with the crown. But the magic of it is that in your mouth, it looks exactly like a normal tooth. So that's what an implant is. Dental implant is basically done when you have lost a tooth or you're about to lose a tooth. So the first thing you have to do when you decide to get a dental implant is go to the dentist, get some x-rays done, and check out with the doctor whether you are going to be a good candidate for an implant or you actually need one. So in a dental exam, the first and foremost thing is taking some x-rays, the doctor looking at your mouth and looking at the rest of your teeth and seeing what is good for you and, what kind of a treatment plan is best for you. So that's the first step. Your medical history is really important in doing an implant because we want to know if your body is going to be able to keep the implant in your mouth. So for example, if you're a smoker or you have a lot of gum disease or, diabetes or something like that, you have to be screened to make sure you're a good candidate for it. So the dentist obviously is trained in the process of selecting whether you will be a good candidate for it or not. They do some other, tests on you like a CT scan. You might meet with a surgeon or a periodontist or somebody specializing in doing implants, and everybody together makes the decision whether you're a right candidate for it or not. Once we have decided that you're a good candidate for a dental implant, I want you to think about it as just a normal filling process or, any normal dental procedure that you've had. You will get numb and then the implant is placed by a very specialized doctor in your mouth, some x-rays taken, and you're sutured up and that's it. And it doesn't hurt at all. And, just the normal part will hurt, like numbing and stuff like that. So it's no different than getting a filling done, basically. So bone grafting might be required at the time of placing the implant, or it might be required at the time of the extraction, depending on what your personal situation is. Pros and cons of having removable or dentures versus implants. You will have to discuss in person to see what is your best option depending on your entire situation. So in our office, we do a full mouth assessment to see what would be the best option for you physically, financially, long-term wise, your health wise. So we take a holistic approach to that and we make sure that whatever option is chosen is the right option for you. The recovery process is pretty fast. I mean, on the day of the implant, you will be somewhat numb and you will be given some antibiotics probably, or some painkillers. And, I have people who go into work after that and they don't mind going to work. It would be nice if you could just take the day off that day and rest, but it's not necessary. If you are, very busy and you really need to work, you can work, you'll just be numb. Dental implants, ideally speaking, should last forever, but it is also related to your general health, how you maintain it, what your general oral hygiene is. So all of those factors dictate your implants. Just like you lost your own teeth, you can lose implants too. So they have to be taken care of, and generally your whole mouth has to be taken care of. Dental implants will not get cavities, but they can get gum disease, just like a tooth gets gum disease. So that's why it's really, really important to go in regularly to the dentist, continue to have your cleanings done, to maintain your home care and take good care of them. The cost and financing options are very specific to your particular need. We have a variety of options available for you, and we do sit down with you and make sure that your particular situation is addressed and that we find a customized plan for you. Insurances cover maybe a little bit of the cost of the implant, not usually, but we will always try to maximize your insurance benefits. We look it up and we always do what's in your best interest and not in the insurance's best interest. To discuss dental implants, you give us a call at 714-744-1242. and schedule an appointment immediately with us so we can make a customized plan that is very specific to you and answer all your questions.